want to talk about some of the most common decisions and or choices and lack thereof that lead to a lot of extra stress, particularly for pregnant mums. Now, I'm Dr. Scott. I'm here having another dad chat. Now, I want to preface this dad chat. This is very much from an observational perspective. So what I've observed over the past couple of months for my wife and conversations that we've had around choices and decisions and lack thereof for people and the amount of stress that it has created. You see, pregnancy is an area where a lot of people have a lot of different opinions, whether that be from experience they've had firsthand, secondhand, or then it starts getting ridiculous. So I'm going to talk about some of the most common decisions and choices, not only that my wife has made to reduce stress, but other decisions or lack of decisions that have been made that have created stress. So number one, the most common decision or particularly lack thereof that a lot of people have made, and I will admit my wife has done her best to avoid this, is to surrender all of their decisions and responsibilities for making such decisions to their primary caregiver. So what I mean by that is, as a pregnant mum, you're going to have a lot of appointments. And a lot of mums tend to go in and see their primary health caregiver, whether that be a midwife, an obstetrician, a GP obstetrician, whatever that person may be, and they just surrender all of their responsibility and decision-making processes over to their health practitioner. Now, probably the best way you can minimize this or avoid that, because that causes so much stress because of a lack of input, a lack of, I don't want to say the word control, but a lack of collaboration with decision making, is to get educated. And this is something my wife has worked very, very hard on over the past probably 12 months, but particularly since being pregnant. My wife has been an absolute consumer of information and knowledge around her choices, her options, and the whole pregnancy process. That is something from an observational point of view as a dad, but also as a healthcare practitioner, I can only applaud and encourage anyone to do. Secondly, when it comes to decision-making processes, probably one of the most common stressors for a lot of pregnant mums is they simply have too many cooks in the kitchen. By that I mean is they are taking on board the opinion of family, friends, healthcare practitioners, work colleagues, random people you have a barbecue and dinners with, etc., etc., etc. Everyone has their own experiences, everyone has their own opinions, and they are 100% correct for those people. They may not be correct for you. So the one thing that my wife has done is she's been very, very selective with whose opinions and thought processes she takes on board. If they're not someone that she thinks is going to bring great value to progressing her in the direction that she wants to go, she is simply politely asked that the conversation doesn't go down that path and they offer too many opinions. She's got her own decision-making process. She's very comfortable with that. The final concept or the final responsibility, the final decision-making process or choice that seems to be thrust upon a lot of pregnant women are the opinions of a lot of other women who have gone through pregnancy who want to tell their horror stories. It seems to be becoming progressively more and more ingrained in women to expect the worst when it comes to pregnancy and childbirth. And I am not downplaying for a second, remember this is a dad observing, I am not downplaying for a second that some people have really rough pregnancy and birth experiences. But it doesn't mean everyone has to have that. And there seems to be this preconceived idea that is being thrust into the minds of many, many women that they simply can't do this. So you see them surrendering choices and decisions over to those who in authority, who apparently have their best interests at heart. The one thing that I can say that I observed through my wife, and the second thing that I have observed through plenty of pregnant patients throughout my time, is that those that are more educated, that those that are more informed, more actively involved in decision-making processes, I would say by far have the better birth outcomes. They have by far the better pregnancies, and they have by far the happier, healthier children. So the one thing I can encourage, and I have continued to encourage and will support with my wife, is to get educated and not to surrender the decision-making processes, to reduce the number of cooks in her kitchen and only take on board the opinions of those that are going to lead her to the path that she wants to go down. And finally, to not expect the worst. To, I don't want to use the word empower, but to position herself mentally, subconsciously and consciously to prepare herself to have the very, very best birth experience that she wants, that's most important to her and the health of her child. I hope to be actively involved moving forward. I have been actively involved to this day, but these are more my observations. So guys, if you have any questions, please leave a comment below. I'm more than happy to ask my wife. She's definitely got herself very, very well educated. I'm happy to share resources that we have used in our decision-making processes, and I am sure that I will have another chat with you soon on Dad Chats.